Preeclampsia. Anyone who's pregnant should know the signs and symptoms of this pregnancy condition, so let's talk about it. Preeclampsia is a pregnancy condition, and you can have it postpartum after you have the baby. That's characterized by your blood pressure rising, and you see other signs of organ damage to your liver or kidneys. It can begin anytime after 20 weeks, and if left untreated, it can be fatal. So, if you are diagnosed with preeclampsia, please listen to the recommendations of your healthcare provider. Screenshot this list of all the signs and symptoms because I just want it in the back of your head if you ever start having the symptoms to call your healthcare provider. So, number one, it would be your blood pressure rising, a headache that doesn't go away with rest and water and Tylenol, visual changes, upper abdominal pain, especially in your right side, a sudden increase in swelling, like you wake up and all of a sudden your hands and feet and even your face are really swollen. If we're looking at your lab work, we'd see protein in your urine. We'd be looking at something called a protein creatinine ratio, and we'd be looking at your platelets and making sure your platelets in your blood are not dropping, and we'd be looking at your liver function. The exact cause of why this happens isn't really known, but many think that it's due to the placenta and the blood vessels narrowing and just not working properly. The cure for this is giving birth. Your medical provider will decide on the severity, fetal distress, how far along you are, on what that looks like for you specifically. Also, you do not automatically need a C-section if you are diagnosed with preeclampsia. You can still give birth vaginally. What to expect if you're admitted to the hospital with preeclampsia will be in part 2, and I'll post it right away.